Irregular bones are bones that do not fit into the standard categories of long, short, flat, or sesamoid bones. They have complex shapes with unique features for specific functions. Examples of irregular bones include the vertebrae, sacrum, coccyx, and many bones of the skull like the sphenoid and ethmoid. These bones often have projections, ridges, and notches for muscle and ligament attachment. They can contain both spongy bone, trabecular, and compact bone layers. Many irregular bones form part of the body's central skeleton. They help protect delicate structures like the spinal cord and brain. The vertebrae are the most well-known group of irregular bones. Each vertebra has a unique shape depending on its location: cervical, thoracic, lumbar. The sacrum, formed from fused vertebrae, is an irregular bone that supports the pelvis. The coccyx, or tailbone, is also considered an irregular bone. The sphenoid bone in the skull is an irregular bone that forms part of the eye socket. The ethmoid bone, another irregular skull bone, contributes to the nasal cavity. Many facial bones, for example mandible, maxilla, and palatine, are irregular bones. Irregular bones often have foramina, holes, for blood vessels and nerves. Their unusual shapes allow them to serve multiple roles in the body. Some irregular bones form joints with several neighboring bones. They provide structural stability to areas with complex connections. Irregular bones frequently serve as anchor points for muscles. They contribute to both stability and flexibility of the skeleton. Vertebrae, for example, allow bending, twisting, and weight support. Irregular bones can vary significantly in size, from tiny nasal bones to large sacral structures. They contain red bone marrow in their trabecular, spongy regions. This red marrow contributes to blood cell production, hematopoiesis. Irregular bones are formed by endochondral ossification, cartilage replaced by bone. They are highly vascularized, ensuring good nutrient supply. Their shapes are often asymmetrical, unlike the symmetry of long bones. Some irregular bones help filter air and lighten the skull, for example, ethmoid. The mandible, an irregular bone, is the only movable bone of the skull. Irregular bones in the spine help absorb shock during movement. They grow through ossification centers that fuse during development. Injury to irregular bones often affects nerves, for example, spinal injuries. Many irregular bones articulate with multiple bones simultaneously. They are critical in forming cavities: cranial, nasal, pelvic. Their irregular shape is adapted to specialized roles, not just weight-bearing. The vertebral column consists of 33 irregular bones before fusion. Irregular bones provide protection for vital organs like the brain, heart, and lungs indirectly through rib attachment to vertebrae. Disorders such as scoliosis involve the irregular alignment of vertebrae. The sphenoid bone is called the keystone of the skull because it articulates with nearly all other cranial bones. Without irregular bones, the skeleton would lack the complexity needed for protection, movement, and organ support.